So I think when you talk about cardiovascular health, probably you have to step back for a second and realize that heart disease is the major killer of Americans, both men and women in the United States. It's really a problem of staggering proportion, and the number of patients who die each year, somewhere around 600,000, and another 200,000 who die of stroke, which is another form of vascular disease. So it's a serious issue. The type of death that occurs is either from heart failure over a long period of time, and so you're disabled, or it's a sudden death, so that you're okay 1 minute and unfortunately not with us the next. And so when you say what are cardiologists or cardiac doctors worried about, those two forms of death and how to prevent them. And when you're dealing with heart disease, you have to consider that one of the forms of death is something you can kind of plan on. Heart failure, how do you treat it? What are the medications? And another where suddenly your heart's electrical system or rhythm changes, and unfortunately you die of the disease. But of course, we have much better medicines, much better technology than we used to have. I actually trained in heart disease a few decades ago, so back in the 1970s, and I commonly make the point that we had 3 medicines in 1972, and now we've got about 50, all of which are effective. So there's a lot more we can do for you nowadays. So obesity is a real problem. I mean, and with obesity comes developing diabetes, and developing diabetes is a major risk factor for developing premature heart disease. So preventing obesity, very important. Some recent data suggests that we're making a dent in this, probably due to a lot of the public health efforts, and also I think Michelle Obama and others have said that this is something that she wants to prevent, and I think that type of thing makes a big difference. I think when you go see a doctor in the office and they talk to you about your weight and what you can do about it, I think that also works. So community efforts and physician efforts, both. TAVR is transcatheter aortic valve replacement. What it means is that instead of doing major surgery in order to replace the aortic valve, one of the key valves in the heart, you can replace the valve using a catheter that is a plastic thin tube that can be threaded up the blood vessels of the body into the heart. And we're doing one right now, by the way, upstairs. Within a couple of hours, the procedure is done, but you haven't actually made any scars or incisions in the chest, and the patient can commonly go home in a couple of days. So it's made a big difference, and it's allowed us to replace the valve in patients who were just too sick to do that previously. So it's extended this life-saving therapy to a much broader group of patients, particularly elderly patients and frail patients who couldn't undergo the surgery that was necessary to do the aortic valve replacement previously. Hackensack is a large academic medical center. We do a lot of teaching, and we do a lot of medical research here, but we also do a lot of medical care. We have more admissions than any other hospital in New Jersey, so we're a big place, and we pride ourselves on having the most current and cutting-edge therapies for patients. So TAVR is one of them, and we've got many other technologies that are not available elsewhere. And in addition, we've got, we think, the best physicians also who can use these technologies and provide these therapies.